In the spring of 2012, Dusty, Alyssa, and I conducted a health assessment of the rural town of Bonanza, Oregon, located in Klamath County. This assessment was conducted as a result of two motivating factors. The first being that Klamath County scored poorly on the county health rankings for the state of Oregon, and the second was due to mandates for the county's health clinics, hospitals, and other partners to conduct a needs assessment of the community they serve. In an effort to better understand the health behaviors of Klamath County as a whole, key stakeholders such as the County Health Department, Sky Lakes Medical Center, and several other cooperatives partnered with the OHSU School of Nursing in Klamath Falls. The goal was to better understand what the Bonanza residents considered to be their community strengths and concerns. This is what we learned. Bonanza, meaning prosperity, began as a Modoc Indian village before the first homestead was founded in July 1873. Located in the rich agricultural Lost River Valley, 25 miles east of Klamath Falls off State Highway 70, Bonanza is somewhat removed from the hustle and bustle of the larger communities. For many residents, Bonanza is their preferred way of life. They have chosen to live here and maintain pride and ownership in the character of the community. Bonanza is a small agricultural community that produces alfalfa, dairy products, potatoes, and grains. There are 5 dairies dispersed throughout the Bonanza area. Bonanza residents are mainly employed in the following industries: 33% in agricultural, forestry, fishing, hunting, and mining, 21% in educational services, recreation and accommodation, and food services, 13% in retail, and the remaining 33% are employed in construction, manufacturing, public service, and many other diverse areas. According to the U.S. Census of 2010, Bonanza has a population of 415 people and a median age of 34.5 years. The median income is around $38,000, and 13.5% of people fall below the federal poverty line. Bonanza has a Caucasian population of 69.6% and a Hispanic population of 27.7%, while the remaining 2.6% are other racial identities. There are 152 houses occupied in Bonanza, 99 of which are owner-occupied. Many residents we spoke with take pride and ownership in the community as their families have lived there for generations. One such resident, whose family has lived in Bonanza for 5 generations, stated, "On the whole, it is a very caring and supportive community. It is a very typical small town. It's my town." Another resident shared, "I just love the fact that it's just a small-knit community, and everybody knows everybody and kind of watches out for each other." We also learned that many residents are satisfied with the health care provided by the local medical clinic, and that parents of the town feel that it is a safe place to raise their children, with plenty of outdoor activities to keep the young occupied. Bonanza is a proactive, tight-knit community where people watch out for each other and provide a proactive approach to community concerns. One such example is the Bonanza School, which was recently awarded the 2012 Oregon School Wellness Award. Bonanza was one of only 3 schools given the award in 2012 for fostering a culture of healthy eating, activity, and exercise. The staff collectively has lost 1,000 pounds since January 2011. The school staff has been making very successful habit-changing efforts in the areas of diet and exercises. These attitudes have been implemented school-wide. Parties for students now have healthy snacks, and the school is encouraging a reduction in the amount of soda intake among the students and staff. The citizens of Bonanza know what is available in their community and what barriers they have to leading healthier lifestyles. One such concern is limited access to fresh fruits and vegetables. In order to alleviate this problem, the community has come together to establish a local farmers market. Starting in the spring of 2012, community members are encouraged to bring selections from their own gardens for sale and trade. This event will be partnered with the Klamath Falls Farmers Market, allowing for the use of food stamp cards to pay for produce. This will provide greater accessibility to families who would otherwise not have the financial resources to purchase fresh produce or travel to Klamath Falls. It was our assessment that the strengths of this community are as follows: proactive for problem resolution, tight-knit and supportive, feelings of pride and ownership, resourceful and creative in working towards improving community health. These strengths are the reasons many residents choose to live in Bonanza. They feel that Bonanza provides them with a sense of security, a sense of family, and a sense of belonging. Through our interviews, we have learned that there is a common theme in Bonanza related to healthcare. Many people have stated that they are extremely satisfied with the services provided by the local medical clinic, but this is a limited resource. Citizens are concerned that there is no specialist in town to address the community needs. In addition, it is difficult to get occupational or physical therapy out to see some homebound patients. One citizen told us, "I know of a couple elderly people that have just recently come out of nursing homes and are needing some forms of therapy, but it is not available because they are out here." There have also been concerns among residents related to the wait times to see a physician in the Klamath Falls area. The two concerns with wait times were that scheduling to get into a clinic is about 4 months out in some places, and that many people spend between 1 to 4 hours in the waiting room past their appointment time to see a physician. One resident shared, "From a parent's point of view, I make an appointment in Klamath to go see a doctor. I'm in the waiting room at least an hour before I actually get back there. And then, the appointment is maybe 10 to 15 minutes. Another resident said, "We took my grandson in for a well-check visit and played in the office waiting room for a good hour at least, and we were in there for 4 to 5 minutes and then we were out." Traveling to Klamath Falls for medical appointments creates a burden on some people because the cost of transportation is so high. Many people we spoke with have to take extra time off work in order to seek health care for themselves or family members. Many elderly people require extra assistance to get into town, and this burden falls on family and neighbors. As a result of the financial burden, many residents try to limit the number of times they must travel into Klamath Falls. One resident said, "I'll go in once a month if I have to. Sometimes I can go longer than that. Sometimes I can stretch it out to once every other month to get the groceries and come home." It is an accepted fact that living in Bonanza means making extra allowances with finances in order to have the money to travel to Klamath Falls. The burden increases when extra trips begin to become very costly for individuals with already limited financial means, or to those who must leave work to seek medical attention for themselves and loved ones. Recommendations based on this community assessment are as follows: expanded accessibility of public transportation, availability of in-home occupational and physical therapy, increased availability and decreased wait time of same-day physician appointments in Klamath Falls. Limitations to this community assessment included lack of funding, a 6-week time constraint, and inexperienced personnel. It is recommended that further assessments should be made in this community for a deeper understanding of their strengths and concerns. The proactive and supportive attitude of citizens of Bonanza places a high importance on individual responsibility. In the words of our focus group members in regards to healthcare, "It is all your choice and you are ultimately responsible for your own health." I would like to thank the people of Bonanza for their assistance in this project. A special thanks goes to the Bonanza School System, the Longhorn Diner, the City Council, the Bonanza Library, Head Start, the Learning Center, and the Bonanza Lions Club.